Today we will talk about early signs of HIV in women. Before we begin, please subscribe our channel so you won't miss the next great videos from us. HIV infection and AIDS has been declared an epidemic since 1981. According to the World Health Organization, 47% of HIV-infected adults are women. Although it affects more men than women, the risk of women getting HIV will increase if the current rate of HIV infection cases continues to escalate. In this video, you will learn what the early signs of HIV in women are, and other facts you may want to know about HIV and AIDS. How HIV works. Let us first talk about HIV before proceeding to the common signs of HIV in its early stages. The lentivirus, named human immunodeficiency virus, HIV, can be transmitted from one person to another through the bodily fluids of an already infected person. Bodily fluids include blood, breast milk, semen and vaginal fluids. This is why those who are sexually active should not consider unprotected sex. Blood transfusion is another major agent of HIV transmission, along with the use of infected syringes or needles. Lastly, infected mothers can transfer HIV to their baby during pregnancy, birth and breastfeeding. What the HIV virus does to your health is that it weakens the immune system. HIV attacks the white blood cells which protect the human body from foreign organisms. The longer you are infected, the less effective your immune system will be. AIDS is the stage where HIV infection is no longer controllable. At this stage, the body will suffer from various health complications, simply because the body can no longer protect itself. HIV can remain dormant in the host for up to 7 to 10 years. Although some people experience the early signs of HIV infection as early as 2 weeks after infection. Early signs of HIV in women. It is important for women to know about the early signs and symptoms of HIV infection, because early diagnosis can increase life expectancy of the infected patient. Healthcare specialists have developed treatments and therapies that are more effective if HIV infection is detected early enough. In the U.S., the Department of Health and Human Services Minority AIDS Initiative are working hand in hand with the government in order to help prevent women from getting HIV infection. Initiatives such as demonstrating projects on women's social networks, conducting outreach and testing programs, and providing funds for prevention programs for the local health departments and community-based organizations. It has been shown that women tend to neglect their health because of work, household chores, or prioritizing children, and is the main reason why women are diagnosed with the infection at a later stage. Knowing the early signs of HIV for women is a way of preventing the infection from getting worse. Listed below are the signs and symptoms of HIV for both men and women, which may occur as early as 2 weeks after infection. Cough, diarrhea, dizziness and fatigue, fever, night sweats, muscle and joint pain. Meanwhile, here are the common early signs of HIV in women. Anorexia, delirium, depression, loss of concentration or forgetfulness, body fat changes, anxiety, yeast infection, weight loss, difficulty in breathing. Note that not all women who have HIV infection experience all, some, or one of the signs and symptoms of HIV as stated above. It is on a case-by-case basis and every woman is different from another. It is also worth noting that women who are HIV infected may find themselves suffering from abnormal menstrual cycles along with the previously enumerated early signs of HIV in women. Abnormal menstrual cycles may begin with one or more missed periods with a worsening over time, until the woman is unable to have her period at all. According to research, cancer and heart disease, developed because of AIDS, are the two main reasons why women die of a serious HIV infection. It is not known exactly when the early signs of HIV in women will appear. As mentioned earlier, some people experience these symptoms earlier as compared to others. Not all infected individuals suffer from the early signs of HIV either. It is best to consult a doctor immediately after experiencing one of the early signs of HIV in women or for both genders. The doctor will let you undergo a test that will confirm whether or not you are indeed infected with HIV.